Good evening, everyone. It's a little after 5 Eastern time. Apologize for the 5-minute delay. We've had a few technical challenges. Mr. Yearout will be joining us soon. Today's topic is to talk about dysgraphia and what is dysgraphia and understand more about it. Now, interestingly, the DSM-5 doesn't really have a diagnostic criteria for a disorder named dysgraphia. It really talks about dysgraphia as being any form of written problem at any level of writing. So that could include letter formation, that could include spelling, that could include sentence structure, punctuation, all those pieces together, all fall under the same diagnosis of a specific learning disorder with impairment in written expression. And although it's not called dysgraphia in the DSM-5, it is actually part of that diagnostic category. Evening, Stephen. We were just given a DSM-5 kind of definition of dysgraphia.
Awesome.
Yeah. And what's surprising about it is there is no actual DSM-5 diagnosis of dysgraphia. It's really just about written expression, but it involves any level of difficulty with written expression. So what I was just reviewing was it could be the formation of letters themselves, which many people will then call handwriting. Yeah, it's a handwriting issue. Your handwriting is not very legible, and sometimes that will be diagnosed as dysgraphia. But it also can involve the spelling components, and that aspect of the written composition system is part of that difficulty. And that's involved in that same diagnosis of a specific learning disorder with impairment in writing, which gets classified under dysgraphia too, but it also involves fine motor skills. And it should not be surprising to most folks that right here on the left side of the brain is the language processor. And that's the phonological processing system. It's part of your Broca's area up here is that verbal speech production system. But just above it is motor control of the mouth, and just above that is control of the fingers. So we know that when someone has more or less efficient wiring, I should say their wiring is less efficient than someone who doesn't have a dyslexia, then you're more likely to have inefficient wiring in that phonological processor. And then right above that, you could also have inefficient wiring in the sensory motor strip is what it's called, which means part of it controls the sensation of movement in the mouth, or part of it controls sensation of movement in the fingers. So if you have a phonological processing deficiency and it impacts your spelling, it impacts your reading, you're actually very highly likely to have decreased oral motor control, precision, or awareness, but it also could be affecting the fingers. So you actually have a harder time holding the pencil grip, and you do a whole club grip, and you're actually using the whole arm to spell or to shape your letters, or you're using a kind of unusual pencil grip where you're flipping the pencil in amongst your fingers in an unusual way, and you're kind of gripping it, and then you're pushing. And what many parents will find is when their children are 3 to 5 years old, that they're actually taking the crayon and they're breaking the crayons. And you're like, stop breaking the crayons. And ironically, the child actually doesn't know that they're going to break the crayon. They're not getting enough sensory feedback about how much pressure they're using on the crayon. And when your body doesn't give you the awareness of how much pressure you're using, then it's hard to push more lightly and not push as hard. And so consequently, you'll see kids, even at young ages, who are at higher risk for dysgraphia, because they're the kids who are actually showing some fine motor skill challenges very young in life. Any experiences with that crayon breaking scenario in any of your boys, Stephen?
Well, I was going to say, I don't know that I was breaking it without knowing it. I probably broke it knowing that I was doing it, so I didn't have to do whatever they were asking me to do.
Yeah.
No, but you were talking about how people hold a pencil or a pen or marker or whatever, and you see that so much, and especially in adults. You'll see them holding the pencil or pen or whatever, all kinds of wompy. Like, how are you even actually writing anything down like that? that looks painful to write that way.
Yeah. And the kids will tell you, mommy, I hate writing. My hand, it hurts. My hand hurts. And you're thinking, how does a child's hand hurt when they're just writing? Well, it's that they're gripping so hard, they're clutching so hard. Think about any muscle group. When you keep a muscle, contracted, after a while it starts to fatigue. And so they're contracting so hard that they literally are fatiguing their hands, or they're fatiguing the body. Or some individuals don't have enough core trunk strength, and the core trunk strength is such that they don't really have the right posture. You should be sitting upright and able to write with the right posture, and they're kind of slouched over and trying to write. And now you've changed all the ergonomics of how the body should work to make writing smooth and efficient and not as effortful. And you're cramping up muscles, and they're doing it to try to brace themselves, so it's more easier to position their body in space and things like that. But because of that aspect of the difficult awareness of where the hand is and how they're holding it with their hand, or how they're slouched their body over and they're writing with their hand like this, they're kind of slouched over. All of that then gets to be more problematic just from the body ergonomics.
That was completely me in school. I would always lay my head down on my, desk or my arm, and I remember getting in so much trouble.
Yeah.
Constantly. You need to sit up. You need to sit up straight. You need to do this. You need to do that. And I'm like, I'm writing. I'm fine. Yeah. Yeah. However, I typically would write so small, yeah, and run all my letters together. That way you couldn't tell if I spelled the word wrong or not. So that's how I hid my misspelling. When I say hid my misspellings. Yeah. But I mean, that was one of the things. So, I mean, hearing you talk about this, brings back a memory of being in third grade, and, I got paddled every day in school in third grade for not turning in homework.
Yeah.
Well, it wasn't because I didn't want to turn in homework. I couldn't remember to do it, or didn't remember how to do it, or whatever the situation was. So after they figured out paddling wouldn't work, they went to making me write sentences. Mm-hmm. And it wasn't until I understood about dysgraphia, I'm like, that's child abuse.
Yeah.
You're sitting there making this child do something for a punishment that is part of their disability.
Right.
And we don't ever think about that when we're, passing out punishments in scenarios like this. So, I mean, I say all of that so we can make sure that, our parents that are watching this, and even our instructors, our teachers, can, keep that in mind. Keep that in mind that, hey, there's a lot more going on than this kid is just being lazy, laying his head down on the desk and trying not to participate.
Yeah, exactly. And it's important for parents to understand most children don't intentionally not perform well. Most children want to perform well. They want to have better handwriting. They want to be able to get, the nice, neat letters and words written. But when you understand the brain and how the brain has strengths or has weaknesses, then it becomes more clear how, again, those languages weaknesses, not on the right side, but over here on the left side, that language cortex weakness here increases the likelihood there's some less efficient wiring up here in the mouth and the fingers, because they literally are the neighbors right there in that part of the brain, those anatomical neighbors. And some OTs will really work really hard on trying to change grip by doing a whole bunch of grip activities. And they're going to, like this, user's saying here, they're trying to help them break that pattern of how they're holding their pencil. But if you really want to change pencil grip, you just don't do a whole bunch more pencil grip work. You actually have to change better awareness of the fingers. You have to change better body awareness of the arm and the core trunk and the posture awareness. So one, you can get the body in the upright position that makes the actual formation of letters easier, because the hand moves more easily as you're doing the letters when you got the right ergonomics. But you also have to change the awareness and the perception of the fingers. And believe it or not, there's something that's called finger agnosia. Very unusual name, but finger agnosia means you have trouble perceiving your fingers in space unless you can see them. And how they test it is they'll have children put their fingers behind a border so they can't see their fingers, and then they'll touch two of their fingers behind their border and say, which two did I touch? And the child has to say, oh, the first one and the third one. And some kids don't have any idea which fingers you're touching because they don't have that double point discrimination, which means decreased sensory awareness in the fingers. If you can't perceive where your fingers are in space, then it's harder to get them to form and to grip to actually hold the pencil in a proper way. So what many OTs who are sensory integration OTs, which means it's a theory and a philosophy of how you approach pediatric occupational therapy, they understand that part of changing that perception is changing more individual finger awareness. And so if you put them in spandex and they're crawling through spandex, they're pushing with their fingers in all the spandex, and every finger is getting some push from the spandex as they're crawling through the spandex. And if they're using therapy and have to pull therapy, and sometimes what they'll do is they'll take a small toy and they'll smash it inside of therapy. And the game is the kid has to pull the therapy apart to get the toy out. And they're beginning to strengthen the fingers and strengthen the fingers. And so they're trying to help increase, one, better motor control of the fingers. Two, they're also trying to increase better perception of where the fingers are in space. And another way that they'll test that finger differentiation or finger fine motor skills is you'll see children, as a parent, you'll see them really struggle to learn how to tie their shoes. And you're like, it's the bunny loop, and you go around the bunny hill, and you're trying to come up with all kinds of stories to make it easier for the kid. But it's really just the child struggling to coordinate their fingers in these small, finesse, coordinated movements. And so you're doing an activity that's up here, and they have weaknesses down here. So it's trying to figure out, how do I get to these skills? Well, we could just do a whole bunch of shoe tying, like you said, writing and writing and writing. But then you're really not changing and training the lower level skills first, and then go to mid-level skills second, and go to advanced skills later. And that's where the expertise of a sensory integration trained OT can help differentiate how much of the hand grip difficulty is perception of the fingers in space. They call that proprioception. How much of it is visual process, because part of writing is you have to watch your hands move on the page. How much of it is motor control, how well you can grip, push, and how well you get the feedback of how the hand is moving. And then how much of it is actually visual perceptual, because you have kids who mix their left and right. Well, if you have trouble judging your left to right on your physical body, you're already going to have trouble then of judging which way is the B and the D forming on the page, because that's very abstract, and you're still struggling with concrete awareness of body position in space. So OTs will work first on body awareness of body in space to help visual perceptual awareness, to help visual motor awareness. So there's a whole complex hierarchy that they can work on to begin to build these skills. And it's not just doing more handwriting. Handwriting Without Tears is a program for that, but that's practicing up here. And if your child just had never had handwriting practice, that's probably going to work beautifully. But if you really want to go treat the cause of the problems, the cause isn't because nobody has shown them how to form letters. Usually kids have had tons of practice forming letters. The more causal factors are these lower level motor skills, sensory skills, visual perceptual skills, and visual motor skills, and also core trunk strength and body positioning. These pieces all kind of feed together.
One of the things that we found really interesting when our youngest son was tested for dysgraphia, his handwriting was horrible. He always started his letters. If you start to make the letter where you start at the bottom of at the line and then go up or whatever, he would always start at the top and go down. He would always do it in reverse order. And then his handwriting was, a lot of times you couldn't even tell what the letters were. But what was interesting is his handwriting really started to improve as soon as we put him in sports. Mm-hmm. As soon as he started playing football, where he was a receiver, where he had to catch the ball.
Yeah.
And as you were sitting there talking about this, I was thinking about, the knowing where your fingers are. Well, you have to know where your fingers are in order to catch a ball.
Right.
right? Be able to catch it or dribble a ball or a lot of these things, and talk about core strength, really getting that core strength stronger. So as soon as he started playing football, his handwriting started improving dramatically. And I was like, wow, I mean, it kind of goes back to them bones, that old Ryan, them bones. Well, yeah, everything is connected. So we have to make sure that, like you were saying, that this isn't something that, oh, my son or my child has bad handwriting, so I'm going to have to go get this type of therapy. No, there's lots of other symptoms that are going to tell you that this is the level that, yes, you need to go seek professional help to get this remediated.
Yeah. And April raises a good question. She says, how does finger agnosia affect typing? Because many times parents will be told, well, he hasn't learned how to write. He's 10. We can't change it now. It's too late, which usually just means the person you're talking to doesn't know how to change it. Of course, skills can be changed. I mean, at any age, skills can be changed, but you have to know the developmental hierarchy of how to build those skills if you really want to change them. So yeah, if a child has that finger agnosia, which means they have really trouble perceiving their fingers in space, and they don't see their hands, they're not as aware of what their hands are doing. If they have really poor proprioception too, they're kind of more clumsy. They're more likely to knock over, the glass of milk on the dinner table because they just misjudge the depth and velocity of their hand movement. If you struggle to do just the work with fine motor skills, and we know typing, the goal of typing is that you can do touch typing and not look at your hands, just type away and not look. That means you have to have good, stronger finger awareness. So for some kids, when they're more significantly struggling with their dysgraphia, and it's really more the letter formation, handwriting part of the dysgraphia, then they're going to struggle even more if you actually ask them to type, because now they just have to stare at the keyboard and type and then look up to see what did they write. Look at the keyboard, type, and look at what did they write, because they're really struggling to learn and memorize where they're at in space with those fine motor skills. So typing sometimes is actually not a good accommodation. It won't give them the ability to really function at a level that might be on target with their IQ level and their ability level. It's kind of like saying one common accommodation is to say, hey, if you have trouble with handwriting and you're not good at typing and you got to take notes in class, just audio tape the lecture. You can listen to it again later. What that really means is, hey, let's double how much time you have to spend in class every day. And typically, most students, whether it's a college class or a high school class, do not have double class time available every day to go listen again and write notes to a lecture because they couldn't take the notes during the lecture. So some of these accommodations are actually not very accommodating, and functionally, they're really not going to really help empower the child to a level they need to be empowered to.
So let's add a caveat to that, because I'll push back on that just a little bit. Because one of our accommodations was we get a copy of teacher's notes. We get, if there's audio of the lecture or whatever, we get a copy of that. And, the teachers and or administrative staff always push back, and they're like, oh, well, they need to learn how to take notes and this, that, and the other. I don't disagree that they need to learn how to take notes. However, what I will say is right now my child's still going through remediation. They still don't know how to spell correctly. So they can do one of two things. Either they can sit there and try to figure out how to spell the words to take the notes and not pay attention to what you're saying and or the lecture, or you can provide them a set of notes and they can pay attention and listen, and then they can go back to their notes, and or if it's videoed or recorded, whatever, then they can go back and watch that also. And at that point, they understood what I was talking about, because there was two deficits there.
Right.
If we're talking about just dysgraphia, which I don't know, I guess you probably could have just dysgraphia, but I'm sure that it's much like dyslexia. I've never met just a dyslexic.
Yep.
So that would be my caveat or kind of pushback as far as accommodations go in school is just to make sure that, hey, if your child is still in remediation, still uh, learning how to read, to sound out, to spell, yes, it is going to be very beneficial for those kids to have, the copy of teacher's notes and or availability of a recorded, session or a class or whatever.
Yep, makes perfect sense. So it's trying to have families figure out what's the best approach. Remediation is one approach, but it's also access to remediation. And what Michelle asks is, okay, so, where's the best place for a parent to go who's requesting testing? Do you want to get diagnostic testing from the pediatrician, from the school, from the psychologist, the neuropsychologist, the OT? It depends on what your goal is. Testing at schools is typically not for diagnosis, and most schools can't diagnose. They don't have staff licensed to diagnose, typically, although some school psychologists can be licensed to diagnose. Schools typically choose not to diagnose. They're looking to see if you are able to be categorized and you meet the categorization of a accommodation or some type of services. Schools typically don't provide services of dysgraphia. They'll provide OT services if it's just a very minimal amount of OT, like letter formation, but they're not going to really work on this whole system that we're talking about of fine motor, gross motor, visual perceptual. They're not going to do that. They just might do some handwriting work, if that. If you're looking for diagnosis because you need insurance coverage, the fastest person who can diagnose is actually a developmental behavioral pediatrician. They're going to do a very brief eval. It's not going to be a whole bunch of testing. And if your child's in that pediatric age and you have a local developmental behavioral pediatrician and you show evidence of, here's his handwriting from school, he can't spell, he can't write a sentence, the pediatrician can choose to go ahead and give you that diagnosis of specific learning disorder with impairment in written expression, which is the actual DSM-5 diagnosis that encompasses dyslexia. And then you may use that to actually go get OT services for the dyslexia, because now you've got a medical diagnosis. Because what many families don't know is you can also go to an OT and get testing from an occupational therapist. But OTs, by their license in most states, they can't diagnose. So you typically will need a diagnosis from either a psychologist, a neuropsychologist, a developmental behavioral pediatrician, or in the rare case, a general practice pediatrician who feels comfortable in those developmental diagnoses. And then you can go find these sensory integration trained OT to actually go ahead and get the OT services.
I do know that in Texas now that dysgraphia is actually in the dyslexia handbook.
Okay.
So they are working towards being able to do some type of remediation. I would just advise our parents to make sure that, if you are going through your school district, that you ask a lot of questions. You need to ask, okay, well, if they are identified as being somebody has the characteristics of dysgraphia and or dysgraphic, make sure that you find out, okay, well, what does the remediation look like? You don't want your child just put into, let's say that they were identified as dysgraphic, but not having dyslexia. You don't want them just stuck in a dyslexia class because they don't know what else to do when it comes to dysgraphia. So make sure that you're asking very probing questions about what is it that you're going to do with my child with this type of remediation. And I would actually say that's good practice no matter what services you're receiving from school.
Yeah, I agree 100%. Now, just for fun, Stephen, I typed in the chat GTP. I said, give me a 10-step dysgraphia treatment program for children. And chat GTP's got some great content. It's technically correct about what it says, but what's missing is this is a list of activities that you might do without actually the formula or the procedures, the steps of actually how to do it. So chat GTP says, if you want to have a successful dysgraphia treatment program, number one is assessment. We've touched on that. Number two is that you should use a multisensory approach to teaching writing, letters, visual, auditory, tactile, but doesn't tell you how to do it. Number 3 is you should do some handwriting practice, but again, doesn't tell you how to do that. Number 4 says you should do some keyboarding skills. Let's hope you've got the finger awareness to actually do the keyboarding. Number 5 is teach some spelling strategies. And ironically, when people really stop back and think about these strategies, when you talk to an adult who doesn't have dysgraphia or dyslexia, and you ask them, when you spell the word fudge, why do you put a DGE in there? When you spell the word cage, you spell it with a GE. Why do you do that? And most adults will tell you, because it's right. They don't, quote, know a phonics rule. So to think that we really have to always do things by strategies, it's ironic to think that, but actually most functional adults who are reading and spelling, and children who read and spell well, they actually don't know any of these, quote, strategies, and they didn't need any of them. And the question should be, but why not? Well, it's because they had strong phonological processing, they had strong decoding and phonetic spelling skills. They had all these foundational skills, so their brain began to just automatically pick up on and understand, oh yeah, that one's got a DG in it, and they remember the visual structure of it, and that one doesn't. And they begin to realize, yeah, they both say J, but no one actually really taught them a rule. So
that was something that I noticed when I was going through Now Foundations. And this is something I want our parents to understand is while I was going through NF Now Foundations, I was, you hear a lot of times about the rules of spelling, the rules of this, the rules of that. However, I struggled so much in just normal spelling or just spelling in general. And or the phonemic awareness piece, really being able to be able to discern the sounds, so I couldn't sound it out, couldn't break it apart. So we have to make sure that I can't remember. I kind of lost my train of thought. I can't remember where I was going with that. The rules. So I was struggling so much in those areas that was I ever taught those rules? Maybe, but I was struggling so much in the other areas. The rules meant absolutely nothing to me, right? So it wasn't, DGE or I before E after, unless it's after C or, the any of the other rules that we learn to spell words. I had no idea of any of those because I struggled so much just to begin with, just sounding out the words. So we need to understand that those rules a lot of times go by the wayside because we can't sound out the word anyway. So the rules mean nothing to us. You're on mute.
Thanks. I knew I was going to do that at least once. Let's take someone who has language processing difficulties, usually has some, auditory memory struggles as well. And let's try to teach them a whole bunch of rules to not only memorize, but to be able to retrieve. And that helps make more clear why some of these phonics programs take 3 to 7 years. It's because you're actually repetitively training this memorization piece with a system that's really not strong enough to do it. The alternative is strengthen the phonological processor, strengthen the auditory working memory that comes with that strengthened phonological processor, enhance that auditory memory system so you can better store words or sentences and better retrieve them. And then it's much, much easier to learn, are there rules that you need to know or are there rules that you really don't need to know? Because many of these, quote, phonics rules are so infrequent. They happen like once in 5,000 words. You're barely ever going to see them. So what's the point of really memorizing them when you're rarely ever going to see them? And so from a dysgraphia standpoint, teaching people spelling strategies typically is not going to be the most effective way to deal with the cause of the problem. The cause wasn't they didn't know all the strategies because typical readers and spellers and writers don't know the strategies. They just are able to remember that yacht has a CHT or a CH in it and you can't sound that out. and it has a letter A in it, which doesn't usually say ah, it's usually an O, and you just have to memorize that piece as well. And their visual memory plus their visual motor system works well enough that it doesn't take but a few experiences with the word yacht, and you can remember it.
So I would like for you to kind of dive into that a little. I know we're talking about dysgraphia, but I think that's really important when you don't have the working memory,
Mhm.
and it's not at the level that you need it to be at. That just memorizing, just memorize it. I mean, that's like telling somebody just to sound it out. So
Right.
can you talk a little bit about that working memory piece?
Yeah, and I put up the question that Brenda Knight Kraft stated, which is executive function skills. Schools need to teach those more. But let's take that apart a little bit, because where does executive function come from? And this ties into this working memory piece. Executive function is a problem solving, kind of reasoning, sequencing type of system that you're really working out and sequencing or executing things. That's why it's called executive function. You're executively executing things that you're going to do. But if you have language processing problems and you have trouble holding on to the words and holding on to the ideas, there's nothing to execute. Executive functions also comes into body. How am I going to get from here across the creek with that one little twig, not get my shoes wet because mom's going to be upset that I'm down at the creek? And you're using your executive function about your body movement coordination to figure out, how am I going to execute this action or series of actions? And do I have body judgment awareness as well, so I know what my body can and can't do? Do I perceive properly that twig, is it too small and I'm going to break when I step on it? So executive function is really a slave system to the left hemisphere language system and to those bilateral sensory motor systems, which means the better function and perception you have of the body, the better you can plan and sequence motor movements, which is using executive function to plan actions. The better language skills, which are part phonological, which is more over here on the left side of the brain, and part imagery, which is more over here on the right side of the brain. You can hold on to words, you can make movies, you can use imagery to hold on to content to begin to plan, okay, what am I going to do for this problem that I'm faced with? So the concept of teaching executive function is, it's not so much, let me again give you strategies of how to reason and problem solve, because if you can't hold on to the information, whether it's body and body awareness, whether it's comprehension and language, if you can't hold on to the information, there's nothing for the brain to execute on. So commonly we'll see changes in executive function when you change phonological awareness, phonological working memory, and this left hemisphere language system is getting stronger and stronger. It begins to drive one aspect of executive function. When that right hemisphere system is trained with a different approach, like mental imagery, and you now can visualize and conceptualize things in images and movies, you can visualize all the steps you're going to have to take to get across that creek, then you're using imagery as another way to actually execute those executive function skills, and it didn't really require any strategies. So there's a big difference from a developmental neuropsychology approach of how you change executive function versus a strategies-based approach, which is more common in education. We believe in building the foundational system first, changing the lower level skills before you can change the higher level skills. And that's that developmental science that we think is going to help empower students to higher level skills on par with their IQ. That's always the next caveat.
I like to explain it when people ask me about executive function. I liken it to business. If you have a bunch of executives in your company without any workers, you get nothing done.
Yeah.
You got to have workers in order for the executives to be able to say, hey, I need XYZ done.
Yep.
And those skills, those workers, whatever, then can go do their piece of it. You can have as many executives as you want. They're all talented. They all know exactly how to run a business, but without all of the underlining people to work, our underlining skills, nothing gets done. So teaching executive function, I think, is kind of an oxymoron.
Yeah.
Would you agree?
Well, yeah, you certainly should be able to do it first from let's build the lower level systems, but it also does have merit that you can actually learn some strategies or some ways to use reasoning skills. There's deductive reasoning. There's,
right.
prognosis, there's estimation, there's induction, there's all different types of reasoning skills. And maybe no one ever taught you how to, do that anticipatory management type of reasoning. So there's some aspects of it can be taught, but it's going to be much more beneficial if you have the executives and you have the workers, like you said. That's a great analogy. The executive knows what's supposed to get done and how to do it, but when the people aren't there to do it, there's nothing it can execute on, so not much is going to get done.
Absolutely.
So let me post this up, Stephen. This is
we have a real quick question here from Michelle.
If a parent suspects dysgraphia, should they also request language testing as well as the OT testing? What skills are tested for during language testing? Now, that's a great question, Michelle. And that goes back to the anatomical neighbors of the brain. On the left side, we said, right, here's the phonological processor. And when it's not working well, you're more likely to have reading problems and spelling problems and get diagnosed with dyslexia. But over this crevice that we call the Sylvian fissure, there's the sensory motor strip, which controls the fingers in that area, very close to the part that is that phonological processor. So if you have sensory motor difficulties, it's not a guarantee, but it is a much higher likelihood that you're also going to have some language processing difficulties. So let's put this both ways. If you suspect dyslexia, should you also look for sensory motor problems? And if you suspect sensory motor problems, should you also, investigate or assess for language problems? And the answer is, it's always better to be thorough. So it's always better, and the only way to know for sure is you get the data. So if there's a question and you're really very concerned about it, and there's certain strong signs of, he struggles with fine motor skills, buttons are really hard to do, shoe time is hard to do. Always, one that many parents find just shocking is, you have a 10-year-old who eats with his fingers. Like, use your knife and fork, but it actually takes so much effort for him to coordinate his hands, to coordinate utensils. It frustrates the 10-year-old. And so he'd rather just pick up the food with his fingers or only order foods that are hand-eaten foods like French fries and hamburgers. So, oh, you're muted, Stephen. Your turn.
I was talking with Dr. Atkins about OT and how it applies with, doing remediation. And one of the things that she was saying was if your child has not, or the length of time that your child actually crawled before they started walking has a lot to do with whether they are going to be as, we were talking about it from a sports perspective, and being able to cross the parallel. So either the midline or the top, bottom, left, right.
Right.
So that's where we as parents, we tend to typically think, oh, well, that's so cute. They're doing these things. However, what we never knew is those are blaring signs that there's an issue and we need to be addressing them.
Yeah.
So we need to stop thinking that all these things are cute.
Right.
And be able to understand that, hey, we need to be really looking for some therapy and getting these issues addressed before they become real issues.
Yeah, I agree. And I think one thing that builds on even further on Michelle's question and your comment is, okay, what testing? Well, there's different levels of testing. There's a screener, which is very basic, and typically only picks up really severe levels of deficit. So an OT, some OT clinics will do 30 minutes to an hour and a half of an assessment. Other OT clinics are going to do a 4 to 6 hour assessment. So you have to understand the differences in what you're assessing and how is it a broad but very narrow assessment, or is it a broad and very deep and very specific level assessment? And that's what you want to talk over with the provider, whether it's an OT. The same thing applies for a speech pathologist. Same thing applies for a psychologist. What's the number of things you're going to assess and how far down that developmental hierarchy you're going to go? And in some situations, screening is just fine. Let's just do a broad screening because we don't really suspect much, but maybe we're missing something. In other situations, you want to screen, but you want to screen with the scientifically most reliable measures of what predicts, a sensory motor deficit, or what predicts a likelihood of dyslexia. And so it's understanding what the research says, what it tells us are more sensitive. And one thing I mentioned in one of the other podcasts you and I did was, if you want to see how well your fine motor awareness of the fingers for your child coordinates with their motor control or fine motor awareness of the mouth, you go watch them eat at ages 4 and 5. And at school, go watch them eat at school. And the kids who are wearing half their lunch in the face and Jell-O shaking over here in their lip, and there's some pudding shoved up the left nostril, and they don't feel it. That's the child's showing you that their sensory motor system is not perceiving that kind of touch at the level that it should be perceiving it, which means it's going to be decreased sensory awareness that might be at the mouth. It could also be decreased sensory awareness at the fingers, which is going to make those visual motor skills, those visual perceptual skills, and even just those motor skills by themselves harder to learn when you really don't have as much of the perception of the touch and the movement system working as well as it could. So you want to consider testing and consider what level of testing and know what you're really trying to help identify. And then you have to decide too, are you testing for diagnosis only? Or are you testing for school categorization? Or are you testing for someplace where you can actually get services? And what April brings up is, yeah, but you might find someone who has the proper training. They've got the sensory integration background. They have a clinic that offers it, but they only want to see you twice a week for 30 minutes. And the problem is, if you do that, it's going to take years because you're not following the neuroscience data that tells us when you really want to change the brain's wiring, it's this steeper amount of practice and high intensity practice, which means you want at least 30 minutes a day, and at least 5 days a week, because you'll make progress faster. Your child will be more likely to reach their goals sooner. It will cost you less money because you won't need to do OT for as long. And the same is true with speech. And then you'll see the child begin to change as well, because now they see their skills getting stronger quicker, and they begin to change their belief that my brain is the problem. It is hardwired differently, and you can't change that wiring. I'm never going to be a good handwriter. I'm never going to be a good reader. And we begin to dispel those myths because now we're giving them the evidence they need to see how those systems grow and change.
Well, and that's something that we have been fighting for a long time, is understanding what is and what is not possible.
Right.
Right. The fact that, just for our parents, a question for y'all is, how many times have we heard, well, they're dyslexic and they're just not going to be a good speller, or they're not going to be a good reader. They're not going to be able to really just keep up with their peers. Absolutely 100% of that is completely false.
Mm-hmm. Mm-hmm.
So we need to get away from, well, let me say this. If you have somebody that's telling you that, they don't know what they're talking about.
Go find someone who thinks you could do more. Go find someone who thinks you can change those skills, because the science is really clear. We have tons of research that shows these skills can be changed. So let me put up now, Stephen, this one last piece, and this is definition of dysgraphia. From a research perspective, it just says, at its broadest, it's a disorder of writing ability at any stage. Problems with letter formation, problems with legibility of letters, problems with letter spacing, problems with spelling, problems with fine motor coordination, and problems with the rate of writing or grammar or composition. So that's a huge category of skills. So part of this is related to dyslexia because it's spelling, which is also usually related to reading. And then it gets into the semantic comprehension system and that composition system. So there's not just one treatment for dysgraphia, because it depends on which piece we're talking about. And this definition really helps break down. There's these basic skill sets, and there's these more complex skill sets. And we want parents to be aware of all of them and decide what can we do to help your child change these skills, because we know these skills can be changed. And we have solid scientific evidence that shows neuroplasticity of the brain is able to rewire at any age. So not only can we change these spelling skills, we have to end with this high note, Stephen. As a man of age 45, did you change your spelling skills when we actually changed your phonological processing? And how did we know that was true?
I knew it was true because my wife has always been my spell checker, my review this email before I send it out.
Yeah.
And you had asked me to write a narrative of, my experience in doing NF, and it took me about 15 minutes to write, I don't know, 3 pages of notes about it, where that would normally take me all day,
Yeah.
and about 15 back and forth with my wife about, hey, can you read this, edit this, whatever, and back and forth. Well, this time she sent back one word in her response, and her response was, wow. She was like,
Nice.
there was absolutely no misspells. This was amazing. And she said that was, although she had seen what had happened with our kids, but she said, at that point, I really knew that something has changed.
Yeah. So we leave the listeners today with the idea that even at age 45, you've heard Stephen talk about his own experiences, how those skills changed. It's never too late to rewire the brain. It always comes back down to what experience are you giving it. That's why it's called experience-dependent neuroplasticity, which means evidence-based programs given to educators are going to be far more effective than asking educators just to guess and figure it out. Same thing is true for speech therapists. Same thing is true for OTs. Giving physicians a room of chemicals instead of giving them penicillin and antibiotics and antiseptics, they would rather have the antibiotics and the antiseptics because they then now have more powerful tools to help them use their knowledge to be more successful. And that's what we want happening in schools and for parents and for kids around the world. So I think it's a great point to end. We appreciate everyone joining, all the great questions, and we look forward to talking to you next week on a new topic.
We'll see you later. Thank you.
Bye-bye.